Hi, this is Dr. Christopher Maloney, Naturopathic Doctor here in Augusta, Maine. I'm going to talk to you about headaches and migraines. Now, headaches and migraines are always seen as a distinct subgroup of headaches, and in fact when you see the studies on migraines, what you realize is there's an overlap because of course if one has migraines or is about to get migraines, whenever they feel any head pain, you're going to have some chronic tension that occurs in and around the head and neck. And so there's going to be an overlay of tension headache on top of a migraine typically. Then we also have things called sinus headaches, which is basically pressure from within the eye, within the the sinuses here and the sinuses here, that can give that pressure and then for many people set off a migraine as well. So migraines are, and head pain in general is treated as a single entity. This is what you've got. This is what we're going to use to treat it. Rarely is it looked at as an entire body situation where if your head is doing that, what's happening in terms of vasoconstriction elsewhere in the body? We're going to have vessels elsewhere they're having problems. Also, it's looked at as this is a disease that you have, as opposed to this is a way your body has of dealing with a set of circumstances. So I've had patients who came to me for chronic migraines, they couldn't do anything, and then years later they say, hey, actually I figured out that I'm really reactive to this substance and it always causes me headaches. And so that's where my headaches were coming from, was I was basically constantly exposed to perfume or whatever it was, and it caused this problem. I've also had other people come in with headaches that just no one could deal with, and they're on narcotics and it's not working. And what's happening is that in this one case was actually a dislocation of the nasal bone. And you fix the nasal bone and you help them pull it out and boom, the headaches went away. For myself, I remember in college I had chronic migraines. I would just have to lie down. But for me, it was a model of chronic 8 hours of studying too hard, and my eye tension would get to be so extreme that I would basically have kind of an expansive, prodromal attack throughout the whole rest of my head, and I would have to lie down. And eventually, I actually figured out to myself that stretching my eyes for an hour to 2 hour while lying in the dark without any noise or anything else was actually helpful at alleviating some of the pain. So I would really look at migraines and headaches as being A, part of the body, and B, as being something that probably doesn't show up just out of the blue. There are known factors that people have had, but beyond those known factors, I think there's a whole range of individual factors that cause migraines and headaches. Within the treatment protocols, we do have, there's the drugs that we use, but there's actually good studies on a Butterbur, which is there's one brand that has actually done head-to-head studies with the best drugs in migraines, and actually said, hey, look, we work this as well as migraines. There's feverfew is the other one, but I've actually seen more effect doing stuff with hormonal intervention or dietary or lifestyle intervention with headaches and migraines than just trying to treat this part of your body. I think that gets to be a very simplistic model that doesn't work often. So this is Dr. Christopher Maloney, Naturopathic Doctor in Augusta, Maine. I'm talking about headaches and migraines. Thank you.